Ladies and gentlemen, I would like to now draw your attention towards the inaugural session of the PCQuest HealthTech Forum. In the past decade, we saw technology pervade healthcare to initiate services like telemedicine, e-pharmacy, personal health management, home healthcare, and others. But both providers and consumers were slow to adopt to these services. Things, however, changed drastically when the pandemic hit us. Mr. Karthik Rajagopal, Chief Operating Officer, Manipal Health Enterprises, is here today with us to discuss why the healthcare system must be equipped with technology to keep future pandemics at bay.
I think we're here to actually go ahead and discuss about keeping the future pandemics at bay. And it's very important to go ahead and look at 2-3 things in this. The first, obviously, is our ability to actually go ahead and predict a pandemic. And that's immensely possible, actually, through technology. It's a wired world, and we'll definitely be able to go ahead and look at a lot of prediction around what's happening around the world and how serious is a particular disease pattern that has an ability to actually take control over the world, much like what COVID did. Moving over from prediction is maybe sometimes pandemics are unavoidable. And how do we actually go ahead and look at it becoming prevent it from actually being a global pandemic and probably keeping it completely localized? And that's where I do believe even in COVID-19, we had enough information around the outbreak in China. Had we actually gone ahead and sealed borders at that point in time, and actually gone ahead and looked at, ostracizing the hotspot for a while, we probably could have got away, in a better shape rather than this impacting, the whole world. So, from prediction to, some kind of prevention, it's important that we understand the context in which predictions are being made, or when the news outbreak happens, what is the nimbleness in each one of us to actually go ahead and look at how we're reacting to a news. I mean, we talk about intelligence, we talk about military intelligence, etc., receiving information. Sometimes we're probably a tad late in reacting to it. Sometimes we're actually going ahead and looking at, information that we receive and act on it pretty early. So the right kind of training actually for people who are part of the surveillance or part of this wired world in trying to, in times of trying to go ahead and get these kind of news, it's important that they understand and react to news basis a certain observed behavior. Unless they are trained, unless they are conscious, unless they are fairly observant, a piece of news that might appear very innocuous can actually later on turn out into something very large, exactly like what happened in COVID-19, where we did have information. Maybe the world was a tad late to actually go ahead and react to this whole piece of news. Technology is going to play a very important role, and that's, I mean, look at a country like India, which is demographically very diverse. How do we actually reach news across, or information across to the last person in the mile in the tier 3, tier 4 cities and below? So it's very important that we actually go ahead and use technology, but use technology in the language and medium that every citizen of the country understands fairly well. Otherwise, it will be lost on him or her to actually go ahead and react to information when they actually start to go ahead and come in. If you start to see the last 18, 20 odd months where we've been actually going through this pandemic, there were pockets of brilliance, there were pockets of extreme intelligence with which we worked, and there was some pockets of mediocrity as well. And that's the mediocrity that we need to actually push away and start to go ahead and look at intelligence working fairly well. And that's, I think, where technology can really work wonders for us. Technology put into the medium or language that people understand, I think, would be the best bet to actually go ahead and look at this pandemic. Obviously, we do not know what the next pandemic will be. We do not know where it is actually going to go ahead and start from. We don't know where it's actually going to go ahead and what's going to be the consequence. But it's important to actually go, understand that, after this, flu that happened in the last century between 1918, 1917, and 1920, this is probably the second one that has actually come into this extent where, it's actually caught all of us by surprise. And futuristically, if you actually go ahead and look at it, sometimes these cannot be avoided. So our approach to this entire, pandemic itself should be very, very different. And that's the realm where we definitely need to actually go ahead and get prepared for. What are those things that we can actually go ahead and look at preparing? Are there enough investments in health infrastructure that's actually going ahead and happening in the country today? That's something that is very, very important, and we understand, from the pandemic itself, as to, is it universally distributed across the country? Private sector, to a very, very large extent, is resident out of the large cities. So, is there an ability through, certain incentives and SOPs, etc., that will enable, the private sector play a very, very important private healthcare sector play an important role in actually going ahead and looking at healthcare that is good quality healthcare that is spread across, the country. We've had great opportunities to actually look at significant collaboration, in the form of private-public partnerships in this pandemic itself, where many hospitals in the public sector were refurbished and, got up to speed, to treat COVID patients. So is there a permanency in each of this? Because during exigencies, during emergencies, it's always easy for us to go ahead and put our best foot forward. But on a day-to-day basis, if there is a conscious, effort to actually go ahead and build, health infrastructure across the country, it will definitely go ahead and help. Because as I told you earlier, sometimes pandemics cannot be, completely prevented. But our approach, if treatment actually starts early, if we do have infrastructure to be able to go ahead and accommodate a large number of patients, the natural in a pandemic that the numbers will surge, it will be very easy to go ahead and keep it under control and not let it take on significant proportions. The second, obviously, is our approach to universal health coverage. And that's another area, because pandemics are something which catches, the most intelligent people by surprise. So it can really put people back in terms of their, ability to actually go ahead and afford. It could be life savings. It could be something significant that they've kept for some other momentous occasions in their lives that actually gets, translated into payment for, treatment during a pandemic. So it's very, very important that we address the affordability part of it also to the large cross section of the population. One is probably like what the government had come back with, was subsidized, significantly subsidized care. But each time a pandemic happens, it's going to really erode the economic value creation of the country. And therefore, it's actually important that we are able to go ahead and create the affordability parameter much in advance, so that, industry, economy is not significantly economically burdened by pandemics. So therefore, that's the affordability part of it is again something that is very important. So basically, if prediction, prevention, in health technology, infrastructure creation, and affordability probably would be the way I would actually go ahead and look at saying how can this, future pandemics be kept at bay. Obviously, it's akin to a military situation, and look at how countries have actually responded to any threat from the border or any threat from any other country. They tend to actually have a lot of intelligence. They tend to have a lot of, preparedness, which actually significantly enhances their ability to actually go ahead and look at, warding off challenges. And I think it's that same, method that we need to actually follow during pandemics as well. And if we are very, very clear that pandemics are some things that would continue to happen, we will need to be prepared as to how we can keep these, significantly under control. So that's something that's going to be very important. Health technology of the future is going to be very, very important. So the National Digital Health Mission, where almost all the medical records of the citizens of the country are going to be digitized, is again a very, very important framework in trying to go ahead and look at this whole preparation around pandemics. Because if the medical fraternity has passed information around, people, and at the click of a button, it's so much more easier to go ahead and look at, treating people early. And this is not only for pandemics, but also during a normal situation, because outside of the pandemic, there are non-communicable diseases, chronic diseases that are also going ahead and getting into very, very large proportions. And therefore, health technology, health information that's actually going to be easily, transferable, the modular part of health technology, going to be very important if we need to go ahead and look at our, country over the next so many years as something that's actually going to be, healthy. And obviously, we would, probably look at summarizing this by saying that what happened during the pandemic was a significantly healthy collaboration that happened between several, service providers, and therefore new models were experimented with. Suddenly, what was not supposed to be a socially distanced industry, what was supposed to be a very touch and feel industry, suddenly turned, virtual. So unless a whole lot of people, they had they not actually come in and collaborated, maybe we would not been able to go ahead and put this kind of a digital front end. Because for most healthcare providers, for most hospitals, they did have a very, very staggered way to go ahead and look at, adopting digital transformation. Maybe over, the next 3-4 years, 5 years, they would have actually got themselves reasonably digitally transformed. The pandemic has actually gone ahead and, completely changed all the thinking. And it's come in that, the last year, where significantly large number of digital initiatives were actually carried out. Healthcare was not something that, and that too, serious healthcare not supposed to be rendered at home. Consultations became virtual, and at one point in time, most large hospital chains had about 75-80% of their consultations completely virtual. Home monitoring systems that actually, came in. The entire, RT-PCR testing technology also underwent significant technology changes. Production of PPE kits, I mean, we wouldn't have been a self-sufficient country until and unless technology had actually gone ahead and taken over. So technology, I guess, is going to drive the next phase of healthcare. While saying that the connect should still be human, the connect should still be, in boundaries where people can actually go ahead and, appreciate. And maybe with all this, we'd probably be able to go ahead and look at our preparedness to be significantly better in the coming days. The next part of it, obviously, is the Gen Z. And those are the people who have been born after 1997, and to whom, Facebook seems archaic, emails seem, of a completely different era, may not be even their grandfathers, but maybe their great grandfathers. How do we actually go ahead and look at, health adoption in this, generation that has significantly, changed the way they approach healthcare? And for me, and I think the, entire example that I would like to go ahead and draw is from automobiles. We talk about generation changes in cars, where a third generation car with the same brand name does not look similar to a sixth generation car. It's completely, different. That is how, human generations also change from the Gen Y to the, Gen Z, and probably even beyond. So I think it's very, very important that this is a wired generation. This is a technology-driven generation. But I think the human connect when it comes to, healthcare is very, very important. We've actually had many occasions where we've actually sat with youth spoken to them, found out about their inhibitions to actually go ahead and look at service providers like hospitals, etc. And their first retort has always been that, guys, I mean, we don't need parents, we don't need professors. We need a friend who can actually go ahead and, understand our health issues, understand our ability to actually go ahead and communicate freely. And that is, I think, where hospitals and service providers, healthcare service providers, need to graduate, significantly, is in understanding this generation, completely. What are their aspirations? What is the ambience in which they will actually go ahead and absorb health news? How do we actually go ahead and have a conversation with them? How do we actually get them to go ahead and open up? These are all significantly important criteria before we overlay technology or before we overlay anything that is a medium. It's at best a distribution point. It's a human emotion connect that is very, very critical. Young girls, they have a number of issues. I mean, they want to discuss about PCOD, they want to discuss about their monthly cycles, but the ability for them to open up will be dependent on how clinicians actually go ahead and react to this generation. They can't probably look at a consultation parameter that looks at one size fits all. Like marketing, like any other industry, it is a target segment that will have to be dealt with very, very differently. And I think that is the first realization that healthcare providers will need to go ahead and look. A lot of work happening, a lot of healthcare brands, keen that this category of youth, this Gen Z, react to or approach healthcare brands in a very, very positive way. Now, brand loyalties, stickiness, these are all maybe things that, the Gen Z may not look at very, very clearly. They will go to where they feel they are being recognized. They will go to feel where they think they're able to go ahead and express themselves. And that's the first change. Now, technology at the end, I mean, will be a leveler, and it will be a medium in which we'll be able to go ahead and pass information to the youth. So I think when you actually go ahead and deal with Gen Z, it's a hybrid between technology as a medium that they understand really well, to the emotional connect that they're able to go ahead and look at, as far as a brand is concerned. That I think will be, we as healthcare providers be able to go ahead and instill the right kind of health consciousness in this Generation Z that we call, as they approach, their teens and beyond. There are health problems that start in pretty much early, and therefore the health counseling, the health intervention, it's like insurance. The earlier you start to actually go ahead and look at insurance plans, the better you are when you're older. It's the same approach to healthcare as well. The earlier that we actually go ahead and invest in our health and take it seriously, the easier it will be. Just imagine that the Gen Z will actually grow on to be the economic value creators in future. If you can actually go ahead and keep this generation healthy, if you can keep this generation free of diseases, etc., absenteeism, everything can actually significantly come down. And look at what it does to the country. That becomes a significantly productive generation, creating so much of economic value for the country. The emotional loss of actually seeing somebody sick at an early age, all that is actually going to go ahead and get transformed. There are many players that are coming in to actually who are going to go ahead and look at predictive analytics, who are going to go ahead and look at artificial intelligence, having the ability to actually predict, disease progressions, etc. And I just hope the youth of today start to go ahead and look at the preventive healthcare culture as something that is very, very critical for them, because nobody likes to be unhealthy. Nobody likes to actually, have an ailment which significantly pushes them, back many years. So with the advent of, technologies that significantly look at predicting diseases, we probably will be able to go ahead and get a population that is so much more healthier, so much more aware, so much more conscious about what they need to actually go ahead and do. And that, I think, is important. So to probably look at summarizing this whole thing, let's not get out of the human connect because technology is available, because technology in isolation may not be able to achieve too much. So it's a hybrid model that will work with this generation. The endeavor should significantly be to understand this generation, their ability to go ahead and absorb, health news in a manner, in a medium that they're able to go ahead and understand. Maybe a lot of elaboration around disease, etc., may be lost on this generation. Short news, like how it comes in various forms that we look at digitization today, should be content that they would be able to absorb fairly easily. From the clinician's point of view, they will need to understand this target segment and what drives them. So, probably if they need to be trained, if they need to be told, if they need to actually do focus groups with some of these, Gen Z kids to actually go ahead and understand what, moves them towards healthcare brands. I think that should be done because, healthcare today is in a very, very different era. As I told you, from a lack of social distance and a complete touch and feel, it's moving towards an era where a large part of the health consuming public would look at healthcare at their doorstep more than they going to be doorstep of the hospitals. And so therefore there is a lot of work to be done in understanding this generation. Hybrid of the emotion connect and along with good digital technology, I think will be the way to go ahead and address this group for a healthier India.
Thank you, Mr. Rajagopal. Now, friends, healthcare and medical education have no immunity to universal, rapidly changing technology. Instead, technology can improve medical skills and education. In medical education, advances like simulation, virtual patients, and e-learning have evolved as pedagogical strategies to facilitate an active, learner-centered teaching approach. To speak more on this, we have with us here today Dr. Pawanindra, Executive Director and CEO, National Board of Examinations in Medical Sciences.
So good morning, ladies and gentlemen, and dear delegates participating in this PCQuest HealthTech event this morning. It's a great privilege to be a part of this meeting. And on behalf of the National Board of Examinations in Medical Sciences, I bring greetings to all of you. The National Board of Examinations is a autonomous body of the Ministry of Health and Family Welfare, Government of India, and its prime mandate is to conduct very important entrance examinations such as the NEET postgraduate examination, which is called as the NEET PG, NEET super specialty examination for the postdoctoral courses, and various other licensing examinations such as the foreign medical graduates examinations for both medical doctors as well as the dental doctors who are qualifying from outside of India. Apart from this, another important mandate of the National Board of Examinations is to conduct training within India in institutions which are outside the medical colleges. So all such institutions, both in the government and in the private sector, which are outside the framework of a medical college setup, where principally the National Medical Commission rules and guidelines are applicable. In all these institutions, we are the body where we accredit the hospitals for conduct of postgraduate and postdoctoral training, and then conduct the examinations for their entry, supervise the training of the doctors during that period of 3 years or 6 years, as the case may be for various types of courses that they are getting into, and at the end of that particular training, conduct exit level examinations also. So as you can see, largely we are an exam conducting body, and therefore it is very natural that we would need the help of technology to improve the way we deliver our examinations and the way we ensure that quality, fairness, and objectivity remains the prime focus of our organization. It is for this reason and it is for this credibility that the Government of India has entrusted very, very high stakes examinations to our body. And I'm very, very glad to share with you that we have been able to use our technology partners in such a manner that the level of reliability of the exam and the level of objectivity of the exam remains at the highest level, and all those processes are effected which ensure that the correct examination is delivered. At the same time, any fraudulent means for leakage of question papers or for other ways in which the same can be tampered with is completely eradicated. Most of our examinations nowadays are held in the computer-based format. That means the candidates are located in the front of a console, and they have to visit the exam centers which are given to them. And obviously, technology partners are required for us to ensure that high quality exams get delivered at these centers. So we have a very sophisticated system of encryption of the question papers. Multiple encryptions are there at our level and again at the level of the various partners that engage with us. And nobody is able to know that what question is being delivered to the candidate till the time it is released in a very, very sophisticated manner with several password protections and several encryptions and decryptions, that the exam paper is delivered to the particular console. Just like you are seeing me here in front of you, the question paper comes in front of the candidate, and then they are able to execute the exam in the time provided. So the issues that we currently have are in ensuring that we have the right candidate appearing for that particular roll number. So it should not be a fraudulent candidate. And we have seen that there are many types of frauds that are attempted by various people who have different motives. And it is our duty as exam conducting body to ensure that such motives are not becoming successful. So we use biometric capturing at the exam centers. We use Face ID now, and obviously the physical document identity verification is also done. What we have recently introduced in the last 1 year is also during examinations, we are doing the face identification, so that in case a candidate swaps or attempts to swap a seat after taking a bio break, then it is prevented and we come to know about it. So you can see that the level of participation of technology is at a very high level. We really are looking for innovations, and we regularly engage with our technology partners to ensure that the level of perfection and level of difficulty of any attempt being made to break our barriers is always improved, and always we are keeping a step ahead of the others who are trying to break these barriers. So the same security measures are also instituted by us when we are issuing pass certificates to our candidates. So in those cases, we need to ensure that it is the right candidate, and those are done in a physical format. And once again, Face ID biometric capture is taken at the time of the release or handing over of the pass certificates, and is compared with their data that was collected at the time of their examination. And even in the last 1.5 years, we have been able to catch people who were trying to break all these barriers, and successfully we were able to utilize technology to the best possible way, such that we could improve this gap and make sure that it's 100% reliable examination. The other places where we are looking forward to innovation is in the way in which we make our question bank. At the moment, the question banks are received from the examiners through encrypted mechanisms on password protected CDs, or even item writing workshops are held in the organization, and then the questions are they are validated by several rounds of processes, and the final product gets ready. It is at this level also that we engage with our technology partners to ensure that we are getting a very good quality product, which is able to be friendly to the examiners who come to modify those questions, as well as it is safe for us to ensure that the process has been completed in a proper manner. The newer initiatives where we have engaged in the last 1 year is in e-logbook, that is electronic logbook. Because doctors are working in hospital setting, they are working on data generated on their patients. And classically, they have been making logbooks of their patients in a physical format, writing it down. Nowadays, with the use of smartphones, either Android or Apple-based, we have now been able to get into a platform which is able to give the access of this electronic logbook to the candidate, and the candidate is always under a supervisor. So there is a dedicated username and password and a login for the candidate, and there is a separate one for his own student, for the teacher. And this is another thing where technology needs to be brought in and modified and upgraded at a regular interval and regular pace. We have also engaged our students in writing thesis work. And this is another area. We have created a thesis repository, which is electronic now. And the whole idea is that research and innovation can be collated into an electronic library of thesis, and it can generate high quality publication, which is bringing knowledge to the medical journals at the highest possible level, and gets recognized and gets incorporated as an advancement in science and technology for application for the betterment of patient care. Lastly, it's a very important function that we added during the COVID. Using this pandemic as an opportunity, we started educating our students, which are present in the entire country in both smaller and larger cities, through conduct of webinars. And that is another place where technology is required to access these examinations, to access these students, and make sure that the information goes to them. And along with this, we were able to do a centralized conduct of examination, what we called as objective structured clinical examination, which was run from the national board, and at the same time, the question was being given to the practical centers where the candidates were seated, and they were able to get this question and they were able to answer it at the same time. That was another innovation that we did. Now, because medical sciences are hands-on sciences, they need assessment of hands-on skills. The newer innovations that are required from the technology partners is to take hands-on training through the digital mode and ensure that this hands-on training can be given across this medium through which I am communicating with you today. So this is an important innovation. We have already started baby steps into it. In fact, I have personally started this as a project for surgical simulation and training. And I'm sure this is just the start, but we can ensure that this hands-on training, which means that when I am doing it here, the person who is receiving it does not only see and hear it, but actually does it. And I am also able to see what he or she is doing. So it's actual mentoring for the students. I think that is the highest level of digitization and skill enhancement that can happen through this media. So once again, I would like to thank the organizing committee of the PCQuest conference on healthcare technology for this very kind invitation. And we look forward to engaging with technology partners in transforming healthcare and transforming examination delivery and examination conduct in this country today. Thank you very much for this patient hearing.
Thank you, Dr. Lal. A little effort today can have big results tomorrow. That's why personalized preventive medicine is the healthcare of the future. Digital technologies have immense potential to power personalized preventive healthcare. But how? To enlighten us on the shape of preventive care tomorrow, we have with us today Mr. J. Srinivasan, founder and CEO, RedMed Health Systems.
Hello, I'm J. Srinivasan, an entrepreneur and founder of RedMed Health Systems based in Bangalore. RedMed enables affordable preventive care for early detection of chronic disease and hopes to do so by extending care by design beyond its traditional confines. Imagine this for a moment. We are in late 2022, and the COVID pandemic has been beaten back comprehensively. What do each of us seek from the healthcare of the future that is attractive to our needs, even before we need it? I expect this will be some version of being healthy, not being diseased, or not being hospitalized. That is, in fact, a tall order and calls for the kind of preventive care we need in the future. Luckily for all of us, there is now a virtuous alignment of many stars: need, awareness, disease context, political momentum, and technology. All we require is design for execution. Every transformation has a genesis in some singular event, and preventive care, as we know it today, is no different. So what is the future state in the light of history? Much of the stream of industrial innovations we have hitherto observed, been affected by, taken a part in, consumed, and taken for granted through much of the 20th century and continuing to the present day, had its origins in the onset and during World War II, when the US government embarked on rapid emergency wartime requisitioning of extraordinary funding for research, and together with it, the assembly of extraordinary minds in diverse areas from mathematics and statistics to natural sciences to engineering to managing complex systems. They were put to task to solve complex and barely understood problems confronting war: weapon systems, communication systems, security and encryption systems, navigation systems, vehicle systems, chemicals, biology, material science, you name it. These activities happen in all parts of the world, but were brought in great focus and the results available and exploited as industrial innovations for decades after the close of the war in the United States and as spillovers eventually in the rest of the world. We live daily the benefits that accrued from these disparate and diverse activities that were accumulated in those initial years and arising out of an emergency. Healthcare from 2021 onward will be no different, thanks to the ongoing pandemic, our singular contemporary event that focuses minds, energies, funding, and long-lasting innovations. It has brought particular and acute focus, again thanks to an emergency, to issues like availability, accessibility, affordability, assurability, and auditability in the conduct, efficiency, and delivery of healthcare to large masses of people. The talk today is a vaccine specifically to slow and end the rampaging virus, but it could well be of healthcare in general and prevention in particular tomorrow. The pandemic is that singular event that presages an impending transformation. The classic pyramid of care. In medicine, a classic description is of a pyramid: preventive or primary care at the base, secondary care in the middle, and tertiary care at the apex. It shows graphically how human beings transition through the stages of early, low complexity medical issues to very complex ones requiring hospitalization and the intervention of specialists. A majority of health issues lies at the base, affecting the largest segment in a population. In everyday problems and niggling issues like cold, fever, aches, and pains, they are the easiest to solve for least cost. But the reality of how we approach health care all across the world is muddled in this very description of transition. Most healthcare systems at the base are basically stationary, while activity gets loaded onto the top. In both cases, healthcare as a system is passive, and the consumer is an equally passive participant in his or her care. We were witness to this in a dramatic way last year when the COVID-19 virus that called for vaccines at large quickly overwhelmed the system at the tertiary end when complexities arising from age, comorbidities, and rapidity of organ failures collided with an inability by hospitals to cope with surging admissions, inadequate oxygen concentrators, ventilators, and drug shortages to treat respiratory disease. Where does preventive care miss the bus? Let's take an example. An adult in his 50s visits a doctor, a general practitioner, complaining of some problem. The doctor treats for the symptom, an episodic visit that may go well or may not. Individual returns home. Days or weeks or months later, the person is hospitalized for a heart attack. Further tests show blocked arteries and procedure initiated. What we have is one of the possibly many episodic preventive care visits that did not discover underlying major issues and resulted in a later acute care hospitalization, entailing much aggravation, trauma, and expense. As we all know, this is not unique. Could this have been avoided? Yes, but only if the healthcare systems are designed and adapted for a much more sophisticated and proactive preventive care delivery. It entails recognition of the critical difference between acute and chronic diseases and how the latter could be made reversible through early detection and acute hospitalization minimized to a great extent. The pandemic, of course, is an extraordinary once-in-a-lifetime occurrence, but the healthcare systems have always operated within the same exigencies in simultaneous small segments, not whole populations, as with the pandemic. We call them acute illnesses and chronic diseases. And they work in pretty much the same way as we observed with the virus, something not tackled in preventive care that explodes in an acute care setting. The numbers are more gradual, but the end results are the same. Global burden of disease. The WHO estimates that 50% of the global burden of disease today owes to chronic diseases. Chronic diseases differ significantly from acute illnesses. They are often lifelong, slow in gestation, and reversible when detected early. The complexity increases with comorbidities when more than one chronic disease exists simultaneously. The good news is that they can be treated and reversed when the individual participates in a system that calls for active participation of consumer, clinicians, and non-clinicians alike, and health indicators are monitored often, risk identified and stratified, use of predictive measures, and in providing proactive care. All this calls for a complete revamp of how healthcare systems are structured and care services delivered. The required overhaul, therefore, would start with increasing funding for preventive health by an order of magnitude, while recognizing that there is a possibly fine balance in funding between acute and preventive health. It also calls for placing the consumer of health at the center of a symphony of players that includes stakeholders in the healthcare fraternity, professionals, providers, insurers, drug and device manufacturers, pharmacies, and those outside, such as employers, policymakers, government, etc. Finally, it equips the system with a panoply of tools to make delivery of preventive care seamless across time and space in the form of adequate staff, process and methods, standards, and technologies that could be brought to bear to address the issues. Transforming preventive care. Such a transformational preventive care has to be designed from the ground up, but it can be hastened through learnings from other industries and absorbing where and how innovations happened. Industries such as automotive, defense, financial, telecom, retail, logistics, technology, etc., contain a lot of embedded knowledge in the form of standards, processes, and systems, vendor accreditations, recruitment, training, etc. The military standard in the US, MilSpec, for example, are defense standards that go back to the Civil War and has been responsible for everything from height of tables to sampling and testing of circuits that have shaped and influenced product development in civilian life. In more recent times, the technology sector has demonstrated the value of open architectures, interoperability, plug-and-play schemas for third-party services, identity verification, and security. Transformation requires recognition of and addressing issues relating to the several cogs in the wheel. So future preventive healthcare, at a minimum, must include making complex administration viable through decentralization of ownership and accountability to perhaps the PIN code level. In technology parlance, this would be called distributed architecture. Ensuring mandatory citizen screening and monitoring of basic vitals parameters. Giving consumers choice in the matter of care and to offer their current provider as default. Transparency in pricing by means of rate cards, and preferably have any subsidies credited directly to the bank account as under DBT. A level playing field for player-neutral provision of services relating to care by the public and private sector alike. Vendor accreditation and empanelment that enables interoperable plug-and-play services to be offered that fosters competition and low cost, such as, for example, through the implementation of fast healthcare interoperability resources, FHIR or FHIR. Security, transparency, and traceability through the implementation of blockchain. Incentivization and disincentivization of all players, including consumers of health, through appropriate behavioral psychology constructs and models that preclude gaming and directs behavior in desired ways. Efficient data structures and data science that enable collection of appropriate data that could be captured as useful real-time insights with the use of algorithms, machine learning, predictive analytics, and heat maps showing real-time trends and specific clinical variables of interest within the demographics and geographical areas for appropriate action. Care that adapts to the 4 Ps: preventive, personalized, participatory, and predictive, and intervenes proactively before an issue of health gets to become acute. Many of the pieces are already here today in dribs and drabs. Advanced sensors making continuous and home care possible, high bandwidth and connectivity for our connected devices, remote access to doctors and other healthcare professionals, easy monitoring of data, and real-time risk computation. The larger complexity lies in intent, cultural change in terms of administration, and focus on outcomes, economics, and behavioral change. In a manner harking back to World War II, this preventive care of the future would be the outcome of innovations coming from all quarters in incentivizing consumers and providers alike to collaborate and participate in active discovery of potential risk, progress towards distributed care models, novel methods to attract investors to share in the upside from positive outcome measures, and a very disciplined and razor-sharp focus on clinical outcomes. Thank you.
Thank you, Mr. Srinivasan, for that informative and useful talk.